Welcome back to Mike Burston and Friends. And this time, my friend is more than a friend. Let me tell you a little bit about him because I have been blessed in my life to have many, many dear friends all over the world. But neither one of them, not one of them, ever saved my life. But the friend that you're going to meet now actually did. And that's not his claim to fame, but to me, 22 years ago, he did save my life. We'll talk about that a little later on. But first of all, let me tell you a little bit about my friend, Dr. Dudley Danoff. Uh, Dr. Danoff was born in Brooklyn. That's next to where I was born in the Bronx, but I'll forgive him. But he attended Princeton University, graduated Phi Beta Kappa, summa cum laude. He then received his medical training at the Yale University School of Medicine, graduating with the highest honors. He then went on to Columbia Presbyterian Medical Center, returned to Yale New Haven Medical Center for additional training in general surgery, completed his urologic training and fellowship at Columbia Presbyterian Medical Center in New York. He served in the United States Air Force as a major. After that, he came to Los Angeles, where he has been on the faculty for UCLA Medical School for more than 25 years, and established the Cedars-Sinai Medical Center Tower Urology Medical Group here in Los Angeles. He is probably one of the most renowned, internationally renowned urologists, and he is my dear friend and has agreed to join me. Dudley, did I sum it up?
My mother would be proud, Mike.
But by the way, did she want you to be a doctor?
Well, my father wanted me to be a lawyer. My mother wanted to marry a Jewish girl.
That's all she cared about.
Yeah, that's all she cared.
Well,
yeah.
And you did.
I did indeed.
Oh, you got to tell Chedva, by the way, that amazingly, I was at your wedding. How many years have you been married?
Either 40.
I'm putting you on the spot now.
either I think 49 or 50. But who's counting? The next 2 or 3 are going to be the toughest. That's what they tell me. A long time.
Well, we're talking during the obviously during the pandemic. Otherwise, we would be sitting opposite each other. But we're doing this via Zoom, and the last 6 months are kind of seemed like 49, 50 years.
Absolutely.
When you're together with your wife day in and day out. But we're very lucky. Chedva is a dear friend. Actually, I found something this morning. You'll tell her, if you're still talking, you'll tell her that I'm going to do, they asked me to do a YouTube channel like I'm doing here in the States, in Israel. I'm going to start that very soon, and she'll be my first friend on that YouTube channel. And today I was just looking through some old things, and I found some photographs. Take a look at this.
Oh my God. Yeah, Chedva the David.
Can you believe that? That's got to be, that was in Tiberias, and that's got to be like, and here's.
So that's probably probably around 1970, I would guess.
No,
69.
Earlier. It's like 69, 68, 69. That's when we first met as well. Well, yeah. My dear friend, I started out by telling my friends here that you saved my life. And let me just summarize it. 22 years ago, actually this month, August, I was diagnosed with prostate cancer. And I came to you, my friend, and said to you, what do I do? Remember? Actually, you're in your office now, right? You're in your office?
Yeah, same office.
Same office. So I was sitting, not virtually, I was actually sitting opposite you. And I said, what do I do? And I said, let's exchange roles. I'm sitting where you are, you're sitting where I am. What would you do? And after doing some tests, you said to me, I suggest that we operate, we'll remove it, and I guarantee you a cure. Those were your words. To hear that from a doctor is very rare. I don't think any doctor would undertake saying that to a patient, but you did, and that was 22 years ago. So you see,
But what you also forgot was you were about to get married to the woman who is now your wife, and you were very concerned because of the nature of the surgery and prostate cancer and sexual function and continence. You were very concerned about those matters. I remember, and I think what I not only did I guarantee you a cure, but I said I'm going to make you a better man than I am. and all of that came true. At least when I spoke with your wife last week, she had a smile on her face. So something must be working. Yeah, that's the truth, Mike. Yeah, and you know, in those days, 22 years ago, we didn't have the robot. So if you came into my office this week or last week, I would propose the same operation for you, done with a robot, done without any incision, done as an outpatient basis, with even more of a guarantee, you know, that you would be potent, incontinent, and so, you know, things have changed a lot. And when I look back, you know, those were primitive, in a sense, primitive times. And, you know, I guess we had some skills at that time, and we exercised them in your favor.
well, for people who don't know, that was almost what, like a 4 or 5 hour operation, or maybe even longer, because
No, about 4 hours, yeah. But it was the way we did. That was the operation we did, you know, 10 times a week. And now with a robot, it's extraordinary. It's just magnification. You know, I'm ambidextrous as a surgeon, so I can pronate or supinate, that is, turn my arm 180 degrees either arm. But with the robot, 360, upside down, inside out, 15 times magnification, virtually no blood loss. In my 40 plus years as a practicing urologic surgeon, it's the biggest innovation and ever. But anyway, look, you survived the horse and buggy, and here we are in the jet age.
But Dudley, you know, that's the whole thing. In those days, it all depended on the talent and the hands of the surgeon. There wasn't
Well, you know,
robot. It was
that's
all in
true.
your hands, and that could have been gone either way. It could have been total impotence or incontinence, depending on the
Oh, absolutely. Oh, absolutely. So the incidence of impotence and incontinence was what much greater. And yeah, there was a certain manual dexterity and surgical skill, or as my grandmother would say, gold in the hands,
yeah.
gold in the hands. You know, so the robot has taken that away, but still, the surgeon, now that I'm sitting at the robot, it's the skill of the man at the controls that's just as important, if not more important, than the surgeon actually hands in the wound. Now we don't put hands in the wound; we put instruments. Everything is done with a robotic arm, but it's still the skill of the surgeon sitting at the robot, controlling the various arms. That still is a very, very difficult skill to learn, and there are good robotic surgeons and bad ones.
That's usually a 16-year-old kid that just came from his
Nintendo.
Nintendo.
It's true. It's true.
Well,
It's true.
wasn't that a skill developed early on at Johns Hopkins? I think it was a surgeon at Johns Hopkins that developed the nerve sparing.
Yeah, but that was in the days when we were doing what we called open surgery, which is an anatomic way of doing it, which was developed by a surgeon who actually used to be at UCLA and then moved to Johns Hopkins. But he's irrelevant today because the robotic technique, the nerves are magnified 15 times. You could see nerves, on the robot on the screen that you could not see when we did open surgery. So we relied on that technique in your day, but now it's far, far advanced. It's much easier for someone to learn the robotic way of doing a radical prostatectomy today than teaching them the open surgical method. It was in a deep, dark hole. The prostate is deep in the pelvis. It's behind the pubic bone. With the robot, it's up there, on a 6-foot Sony screen. So anyway,
and my luck, I guess, was that you didn't give up. First of all, the PSA is a test that actually was the first inkling that there may be something there. And the first time you did a biopsy, I think it was, and you didn't find anything. And you said, well, I'm not giving up. Let's do it again in like 6 months or 3 months because I have a suspicion that there's something there. And you found it second time. Let me also remind you that I had just been cast to start in a new Broadway show, a Broadway tour, portraying Al Jolson. Remember, I had just gotten the part. Actually, I as I was lying on the table and you were doing what's it called when you insert that thing and do you take
cystoscopy.
Yeah, look. See, yeah, Siona knocked on the door and I'm lying there and she said, "Can I interrupt you for a minute? I want to give you some good news. You just got the part."
Yeah.
I had to, like a week.
I don't want to tell your audience, Mike, that I had to use, extra large instruments for you. I thought that would be a secret, but I just couldn't help but let the public know the real Mike Burston.
I think I'm gonna edit that part out. I'm gonna cut that out. No, but that was a week later. I was on a plane. A week after the surgery, I was on a plane to the East Coast to start, working on a musical. It was crazy. But anyway, so thank you, my friend. And since then, you called me your poster boy, right? Am I still your poster boy?
You're still my poster boy. And look, I appreciate, all the good things you said about me in Israel and all the favorable press you gave me in so many articles over the last 20 years. I mean, you're practically my public relations firm, so that every Israeli that comes to LA on El Al somehow finds his way to my office, and I owe a lot of that to you. I mean, I owe a lot of that to Chedva, but a lot to you.
Thank you, my dear. And I wanted to ask you, as we're just talking about the advancement that's been happening. How has it changed the last 6 months? I mean, now we are in August of 2020. This pandemic has been going on now for 6 months. How has it changed your practice? What's been happening?
Well, certainly at the outset, when we were all very confused, the cases were coming up left and right, and we didn't really understand it like we understand it now. We stopped doing elective surgery. We stopped seeing elective patients in our office. So basically, we were just seeing emergencies. And that went on for about a little less than 2 months. And then when we began to understand a little bit more about the virus, contact tracing, wearing a mask, social distancing, we began to do elective cases again. The hospital loosened up, so there were ICU beds available and post-op beds available for the COVID patients and for regular patients. And right now we're just about back to normal. We still have a few patients, mainly elderly patients, who are afraid and fearful of coming to our office for their routine checkups. So a lot of them still are not coming for their routine follow-ups. Bladder tumors, people like you with prostate cancer, they need to be followed, recurrence, kidney cancers. But by and large, things are back to normal. And our hospital is adjusted so that we have the availability of beds for the COVID patients and for the average patient who needs elective surgery, bladder stones, tumors, polyps, inability to urinate, that sort of thing. I am a urologist, and that's what we specialize in. Kidney, bladder, prostate cancer, stone disease, infections, etc.
Et cetera, et cetera, et cetera.
Et cetera, et cetera, et cetera.
And just for my friends who are watching us, the stories that I've heard, I'm sure you can't divulge any secrets, but some of the patients you have treated over the decades have been pretty famous people. I remember, I think you got an award or a citation from the Emperor of Ethiopia once. Am I right?
I did. And I also had the privilege of going to Thailand and operating on the King of Thailand, who passed away about 2 years ago. And that was very exciting. I brought all my equipment. I wanted him to come to Cedars, but he's a holy man. He wouldn't leave Thai soil. He was a Harvard-educated guy, very interesting guy. And I went to Thailand. I took Hedva. I took my nurses. I took my equipment. I operated on a couple of subjects, of his subjects, with the same problem before to make sure everything was going well. And I didn't quite appreciate, what a revered figure he was. And, he was just a little Jewish urologist from Brooklyn operating on a King of Thailand, and everything was successful. And then when I came back, I said, my God, what if I would have failed? I mean, the Thai secret police would have probably hung me by my genitals. So, that's called the big set of baits.
It's called chutzpah, yes. It's called chutzpah.
Yeah, but it was a very exciting experience. Look, one of the reasons why we have operated on some, very famous people, I could tell you about people who were deceased, Frank Sinatra, Gregory Peck, people like that, is because Cedars-Sinai Medical Center.
Is that why they're deceased?
No. No, they somehow survived Dr. Danoff's touch. But, Cedars-Sinai Medical Center, which is this 1,000-bed community teaching hospital, is, right in the middle of the entertainment districts on the borderline of Beverly Hills, West Hollywood. We have all the studio people, all the movie, television. So, they're ordinary people. They put their pants on, one leg at a time. And if you treat them decently and honestly and don't make any exceptions, they're very receptive and very, very nice. I mean, like other people, there are some really great ones and mostly good ones, and some that are very difficult. But most of them are just people.
Yeah, there's a Yiddish expression that ultimately even the king has to walk to the restroom, to the bathroom. I mean, they used to carry the king wherever the king went. They had to carry him, but there was one place where he had to walk on his own. So ultimately, we're all the same. And Tower is still your partners are still with you. You created.
Oh yeah, now more than ever. I mean, I'm doing this for a very, very long time, and I have 10 young partners. All of whom I've trained. They're all my people. I have great faith in them. They have a skill set that I don't have, the so-called Nintendo skill set. So, Tower Cedars-Sinai Medical Center, Tower Urology is actually bigger and stronger than ever. And we're still here and still growing. We just added 2 young people the 1st of July, and we're moving to the west towards the marina. There's a lot of development there. There's a new hospital there. We're establishing a presence. So we're doing just fine. Thanks for asking, Mike.
And speaking of young people, my son Peter After my experience, a few years later, he was diagnosed as well. That was about 10 years ago. He was in his 40s. And
Correct.
at that time, the Da Vinci, the robotic, was already available. And you saved him as well. God bless him. He's now,
Which tells the tale. I mean, for your listeners, if you have a male member of your family who has prostate cancer, you, as the member of the family, are 30% more likely to get a prostate cancer. There is a genetic leak. So anybody who has a relative with prostate cancer, age 40, get your PSA. PSA is not the name of an airline. It's a blood test called prostate specific antigen. Very simple blood test, and it can detect prostate cancer long before we could diagnose it clinically. So, word to the wise.
I tell all my friends, and then whenever I go back to Israel, I work with the association, the Israel Cancer Association, because we lose men, for no reason, because
No reason.
the Israeli macho says, no, I don't go to get any physical examinations, and it's just a blood test, and it really saves lives. So that's so important. I wanted to ask you also, is there any correlation between female uh, cancers, for example, ovarian, as opposed to any connection to prostate cancer in the male? Let's say if your mother had a
No,
gynecological
no,
cancer.
no. Your mother is spared, or you're spared any of your mother's diseases. It doesn't.
It's
There are
not.
no urologic diseases from mother to son. No.
Gotcha. Okay. Well, my dear friend, thank you so much for taking this time with me. I'm going to ask you a question I ask all my friends. If I were to ask you for one individual who inspired your life, I'd like to know who that would be.
Well, next to Chedba Amrani, I would say it was my father. Uh, Often wrong, but never in doubt. He was a very strong, straightforward, no nonsense, disciplined guy. Uh, I adored him. I would never have disobeyed him except a couple of times. But he was a very inspirational figure for me, a real role model. And I hope that I'm that kind of role model for my children and my grandchildren. I mean, I'm in practice 50 years, and I have never in 50 years, not once, never once in 50 years, missed a day in my practice. I've taken, plenty of vacation time and, been away. I won't be in on Tuesday because I'm going to play in a golf tournament, but I never, you know, broken leg, broken arm, shoulder replacement, cough, sneeze, the influenza, a hangover. I never missed a day, Mike. So a work ethic, an integrity, a love of people, no anger for anybody, no animosity, no hard feelings. I learned that all from my father. So
Dudley, my friend, you are my inspiration, and you're my dear friend. I mean, people once in a while tell us that we're like brothers, and I feel like you're the brother that I really never met. So I love you, and pretty soon we'll be able to do this in person and smoke a nice cigar, have a glass of wine, give my love to.
and, and then you have to try to tell me a joke that I haven't already heard. That's the secret.
Impossible.
Mike.
There are no jokes that you haven't already heard.
Hey, Doc, it's a very embarrassing examination. They all say, hey, Doc, have you heard this one? I've heard every single joke invented.
As you were putting on your glove.
Right. Snap.
The glove and bend over, sir. I love you, Dudley, and carpe diem. My motto. My motto. Carpe diem. Seize the day. always.
Absolutely. And you've done that, Mike. You've done that. You look at the career that you've had, and look at that punim. Look at that, folks. Look at that punim.
Well, we just have to be grateful. We are the lucky ones. And I always say we have to be grateful for what we have and the life we're living. And just get up in the morning and say, Modeh ani lefanech. I thank you, whether you believe in the Lord or not. Thank you for another day. Love you.
Love you too, Mike. Love everyone. Yeah, take care. Thanks, Mike.
And thank you for joining us. And we'll see you again next week or next time on Mike Burston and Friends. Shalom.